What surgeons don't tell you about recovery. Here's something that you need to know. You spend months researching about the procedure, about the hospital, about the surgeon whom you want to do it with. But what about post surgical care? You look in the mirror and suddenly feel, did I make a mistake? The emotional part, the hormonal part, the swelling, the bruising, the way it looks immediately after surgery, the pain, the discomfort that you feel post surgery. What about all these parts? Surgery can be a very emotional decision, and the hormones can actually go for a toss or actually can fluctuate after a surgery. It's just like what you see in pregnancy or after menopause. Hence, you need to be prepared for this part. This is a very emotional part. The first 2 weeks after surgery, there will be bruising, the part will be swollen, there will be discomfort, there'll be difficulty in movement, there'll be difficulty in performing some actions. Some patients even feel constipation, some patients get diarrhea because of medications, and so many other things that can actually happen. A lot of people talk about the procedure themselves, but not about what we call as the post-operative or the post-op blues. This happens because, like I said, the body undergoes a lot of changes and emotional and hormonal fluctuation. And this process is actually a reality. It's not a myth. Just like what you face during pregnancy, it affects your sleep cycle, it affects the way you look temporarily, it affects the way you feel temporarily. You cannot go out socially in some cases. You may not feel or look as good as you want to, and this can actually affect you in a major way. Some patients actually start feeling that they made a mistake, they look terrible. Some patients start feeling very low. Some patients actually have suicidal tendencies. But here is the good part. Once this initial part of the first few days or a few weeks pass, then you will actually start seeing results. All these things start settling down, the hormone levels start settling down, and then you get a sense of happiness. For example, if you see about a nose job, the nose looks terrible for the first 7, 10 days, or even maybe up to 2, 3 weeks. But after that, what you get, you're going to be very happy and pleased about. Bodies also feel different. Every person, every body is different. Some people swell up tremendously, some people hardly swell up. So everybody's recovery, everybody's emotional levels is not going to be the same. Hence, a lot of emotional hand holding, a lot of psychology is required in the post-operative period. A lot of patients actually confuse them with complications. These are not complications. Getting a little bit of forehead swelling or a little bit of swelling around the eyes after a hair transplant procedure, or even getting swelling around the eyes after a blepharoplasty is normal. After doing a nose job, getting some swelling under the eyes or some bruising is normal. It is not unnatural. So these things also have to be told to the patient right from the beginning. They have to be counseled accordingly, and the patient has to be prepared for this in the post-operative period. But despite of telling a lot of patients actually look in the mirror and feel that, have I made a mistake? Have I done something wrong? And this is where the role of the doctor along with his entire team comes in. So now we understand that recovery is not always pretty. The scars look terrible. If you do a breast lift or a tummy tuck, the scar initially, if the patient sees it, it looks absolutely aghast, it looks terrible. But it will settle beautifully into a very thin line over the next few weeks to a few months. So this is where you need to reassure the patient and to make him understand. The good news is you must know that this is temporary. What you see immediately or feel immediately after surgery is very temporary. But what you get final is what is going to stay with you for life. A good surgeon will perform the best surgery, but he will also help you and guide you throughout your recovery period, throughout the post-op recovery period, and he will have a team which does this for you. Okay, so hence, if you do understand that your post-operative period can be a little, can have a little of turmoil, can have a lot of emotional changes, but you're going to get finally good results. And then you understand this perfectly, then do consult us and do plan your procedures, understanding the entire process. So, yes, surgery is fabulous, but even the post operative period has to be equally good.